Greetings and salutations, all my friends. Dr. Ryan here. We are addressing mitral valve prolapse today. Okay, here's our clinical case. Which of the following is an extrarenal manifestation of autosomal dominant polycystic kidney disease, ADPKD? Is it A, aortic regurgitation, B, aortic root dilatation, C, colonic diverticular, D, intracranial aneurysm, or is it E, all of the above? Guys, what is mitral valve prolapse? It's also more affectionately termed Barlow syndrome or floppy mitral valve. So what happens here is that one leaflet of the mitral valve, commonly it's the posterior one, prolapses into the left atrium during ventricular systole, causing mitral regurgitation. It can be a congenital issue or due to myxomatous changes over time. The female to male ratio is 3:1. So the cardinal signs, everybody, of mitral valve prolapse are what we call mid-systolic click and a late systolic murmur. A mid-systolic click and a late systolic murmur. So any maneuver that's going to diminish your left ventricular volume, example, decreased venous return, tachycardia, decreased outflow impedance, increased contractility. It worsens the mismatch in size between the enlarged mitral valve and the left ventricular chamber, resulting in prolapse earlier in systole and movement of the click and murmur towards the first heart sound. All right, so we have an earlier click and a longer murmur. Right. However, any movers that will increase your left ventricular volume as depicted on the right, that being increased venous return, bradycardia, increased outflow impedance, and decreased contractility, will delay the occurrence of the prolapse, resulting in the movement of the click and the murmur towards the second heart sound. You've got the clicks that occur later in systole with a shorter murmur if you have an increased venous return. So in summary, guys, if you've got maneuvers that decrease your venous return, it's in the move the click earlier in systole with a longer murmur. But any maneuver that's going to increase your venous return is going to cause the click to move later in systole with a shorter murmur. How do patients with mitral valve prolapse present? Stereotypically, it's more common among the thin young women. It may be familial and usually asymptomatic, and the most common symptom is going to be atypical chest pain, where in the left submammary region, which has a stabbing quality. Often this is confused with anginal pain. The patients may also complain of palpitation, dyspnea, fatigue, and whenever you inquire about palpitation, you're also going to inquire about syncopal episodes and pre-syncopal episodes. Right, what are the complications of mitral valve prolapse? Well, mitral regurgitation, embolic stroke and TIA, are exceptionally rare. Infective endocarditis is well very rare, as in mitral stenosis, very rare, and not fully well done. We're talking about medium rare, not really medium rare, just rare. And arrhythmia as well in the way of prolonged QT interval. All right. So what are some associations with mitral valve prolapse? It has lots of those. Marfan syndrome, Ehlers-Danlos syndrome, osteogenesis imperfecta, pseudoxanthoma elasticum, your plucked chicken skin. Then HOCM, which is hypertrophic obstructive cardiomyopathy or congestive cardiomyopathy, muscular dystrophy, atrial septal defect in some 20% of cases, systemic lupus erythematosus, and anorexia nervosa. All right. How would you want to investigate someone with mitral valve prolapse? Well, it follows the same principles as we've mentioned when investigating any mitral valve disease. Chest X-ray is a good idea. ECG as well is going to demonstrate some non-specific ST wave changes, and of course an echo. And how are you going to treat mitral valve prolapse? Well, if the patient's asymptomatic, you just want to reassure them. You can do periodic echo, maybe even annually or 6 monthly. If there's atypical chest pain with palpitations, right, that's the call for you now to use beta blockade or any other antiarrhythmic, right, which may be required. If the patient has significant mitral regurgitation or concomitant atrial fibrillation, you want to give consideration to anticoagulation to prevent any thromboembolic phenomenology, and aspirin may be given. In severe mitral regurgitation, that's where you want to call upon mitral valve repair or replacement, right? Prophylactic penicillin is a good idea to prevent infective endocarditis, especially if there's mitral regurgitation in there. Prognosis overall for mitral valve prolapse, everybody, is quite good. Back to our clinical case, what really is the extrarenal manifestation of ADPKD? all of the above: aortic regurgitation, aortic root dilatation, colonic diverticular, intracranial aneurysm, and mitral valve prolapse. So autosomal polycystic kidney disease is a very common genetic disorder, and although the most common manifestations are renal cysts, hematuria, urinary tract infection, occasionally nephrolithiasis, there are some other common extrarenal manifestations, including intracranial aneurysm, and that's why a patient who has severe headache and has ADPKD should have a CT scan to rule out those biliary aneurysms, which has a propensity to dilate and rupture, right, causing a subarachnoid. Aortic root and annulus dilation, valvular heart disease, including aortic regurgitation and mitral valve prolapse. Aha, there we go. Hepatic cysts, hernias, and colonic diverticular with a propensity to herniate. All right. Beloved, the book of 2 Chronicles 7:14 declares, this is what God is saying: if my people who are called by my name shall humble themselves, pray and seek my face, and turn from their wicked ways, then I will hear from heaven, forgive their sins, and heal their land. I believe what we really need right now in this world is healing. And the only one that can bring true healing is the Lord. But we have to do a few things before he can bring healing. We have to humble ourselves, pray, seek his face earnestly, and turn from our wicked ways. Beloved, I pray that will be the cry of our hearts, to seek God, to know him, to fellowship with him, so that we can live holy lives in his sight. And then healing will come. God bless you. Have a wonderful day. I'll see you soon.